Welcome to the Region of Solutions podcast, where we give you the insider's take on the impactful work and initiatives being undertaken at ESCAP. I'm Veronika, Verner.
And I'm Sompot, Suphutthamongkhon.
You know, Sompot, behind every birth, marriage, and death lies not just a vital record, but a story. Civil registration and vital statistic systems are the best tool for collecting all these tales and using them to build a fairer world where everyone's rights are recognized.
Absolutely, yes, Veronika. It's fascinating how something as simple as registration of birth can have such profound implications for individuals and communities.
So that's why in this episode, we will explore how CRVS systems can impact the everyday lives of people in Asia and the Pacific, and how ESCAP and its partners are supporting countries to develop new and effective systems so that everyone gets in the picture.
Joining us today to discuss the importance of civil registration and vital statistics system in the region is Tanja Sejersen from ESCAP Statistics Division and Romain Santon from Vital Strategies.
Thank you very much, and nice to be here. My name is Tanja, and I am the CRVS lead at the Statistics Division here at ESCAP. And we are supporting our members and associate members to improve their civil registration and vital statistics systems.
Thank you very much for having me as part of this discussion in this podcast. My name is Romain Santon. I'm the Regional Deputy Director for the Asia Pacific CRVS Improvement Program at Vital Strategies, a non-for-profit global public health organization working under a bigger initiative called the Bloomberg Philanthropies Data for Health Initiative, supporting countries such as Bangladesh, Sri Lanka, Indonesia, Thailand, Vietnam, Cambodia, and China.
Sounds impressive. So can you maybe tell us a little bit of how you both got into this field?
Oh, I think for me, actually, so I come from a country where censuses are based on registration data. That means that in my entire childhood and adult life, I never received a census questionnaire. This was just kind of something that was done by the Statistics Authority. And then later in life, I moved to a country where suddenly I received one of these questionnaires, and I was very surprised. And then in 2013, when I joined ESCAP, I was asked to join the CRVS team, knowing absolutely nothing about what CRVS was. So it's not the best acronym, right? It's Civil Registration and Vital Statistics, and it's about individuals' vital events, births and deaths and other vital events being registered, and then that data being used for statistics, which actually means that that can become part of really thorough government data and the production of vital statistics, including very basic things like population numbers and fertility. And so for me, that was the interest was sparked back then when I suddenly had to fill in one of these forms.
No, it sounds interesting. And as a fact, they actually still do it in my country. So I participated in it once. What about you, Roman?
So I'm coming more from the public health side of things. I have a background in nursing, and I was working in programs in the region aiming at improving the health of children, mainly on HIV and AIDS, malnutrition program. And then I came to that field a little bit by chance, past experience, and based on the interest that I had to, work towards a work that will really help improving the life of people by really ensuring that every single birth, every single death is being registered, but that we also understand the causes of death of the people who died, to then being able to prevention program, to be able to have better policies, better service deliveries. I think, this is a rather impactful work. I've been very happy to be part of the journey.
That's the thing, right? It is so basic that individuals need to be able to prove who they are to their individual lives. I mean, if you have absolutely no documentation, it's very hard to do very basic things like accessing education, health. Opening a bank account is pretty much impossible. You can't do formal employment. From a development partner perspective, there is increasing focus on this area because exclusion becomes even further exclusion. And of course, when we talk about sustainable development goals and leaving no one behind, I really see these civil registration vital statistics systems as a foundation for getting anywhere on that broader agenda.
It brings us to the biggest question that we ask all our guests. What solutions are you working on for the region?
Well, I think there's a lot of different things, right? So back in 2014, members and associate members of ESCAP agreed to the Regional Action Framework for CRVS in Asia and the Pacific, which is really aiming at three big things. One is about universal registration, so ensuring that all individuals have their vital events registered. The second one is about ensuring that all individuals have the documentation of those registrations. And the third one is about then using all of that data to produce more timely vital statistics and of better quality, including on causes of death that Romain mentioned earlier. But in order to actually get there, it's not just one solution or one action that needs to happen. It's a lot of different things. And a lot of it is really about coordination amongst government stakeholders, but also other parts are really technical on like how do you certify causes of death? How do you code causes of death? I'm a bit reluctant to say one solution. I think there's a lot of different kind of elements we need to work on. And we're super lucky as ESCAP that we're working with many different partners that have expertise.
For our side, we are working very closely, I would say, hand in hand with ESCAP. So there is no one fit for all. We need to kind of really see what other country needs, what is their baseline, where do they start from, and try to see what kind of improvement is needed. In some countries, the system is functional, but the quality is poor. In some countries, the system is not functional at all. The registration rates are very low, and we need to start with that. How can we change the system? How we can improve the system? Digitization on its own cannot fix the system, so we need to look into processes, to look into laws and regulation. We need to look into stakeholders coordination. The core of our work is technical coordination and advocacy as well. ESCAP is doing a lot of work in that area. It's really to raise awareness, to kind of convince people of the importance of CRVS, why it's so essential for it to be strengthened, for it to be universal, that a lot of other government services are depending on it as part of service delivery, as part of better statistics, better information. If the civil registration system is not universal, then there is a risk for a lot of people to be left behind.
So particularly, how could the CRVS system be used to improve the public services in Asia and the Pacific?
There's kind of a few different ways, right? One thing is that the data from registration processes, so basically the basic information about who lives in the country, can be very useful for developing evidence-based policies, right? If you want to know how many schools you need to build, you need to know how many children are being born, right? So it's very basic. So that's one way. But also, and what is becoming much more important over more recent years, is that when we start talking about e-governance and e-government, and we start talking about service delivery where people need to provide proof of identity, the linkages between civil registration, vital statistics, and national identification systems is very key. A national identification system needs to be able to get new people into it and also take the people who die out of it. I don't know if you agree with me on this one, or if you have additional things.
I totally agree with you, Tanja. Like the other aspect that I would add, because it's one of the parts that I'm focusing a lot on in my work, is the public health aspect of this. So by finding the death, by understanding the causes of death, by understanding particularly what we call the underlying cause of death, the initial element of the sequence that led to someone's death, this is an essential information, because a lot of them would be preventable, and based with those statistics, we are able to influence positively prevention campaigns, for instance, so that we understand which population are mainly affected by a given disease, especially non-communicable disease, when we're talking about increasing cancer. So we can, target some screening. We can push for some campaign against tobacco control campaign or road safety campaign, and target specific group, because we are able to do that, or the government are able to do that, thanks to the data that are being produced by CRVS system.
And I think the importance of this really came out during COVID, right? I mean, during COVID-19, governments very urgently needed to know who were dying where in order to affect public policies immediately, right? And the reality is that the vast majority of countries, not just in our region, but globally, couldn't do that because the CRVS systems had been underfunded and under-prioritized for decades. We quite quickly found out during COVID that there were particular age patterns and even some gender aspects of who were the ones who were most at risk of dying of this. But, if we had had well-functioning CRVS systems across the world, I think we would have been able to handle the pandemic better. So this is really, really important. And this is also one of the reasons why the CRVS work in Asia Pacific going forward also has quite a lot of focus on resilience. So how do we create resilient systems, but also how do these systems actually support resilient governments and resilient societies?
So, are there any stories or maybe first-hand experience you could share of the impacts of ineffective systems in the region, especially on the marginalized communities?
Maybe I can start with one area that we didn't really talk about, right? Which is related to human trafficking, child marriage, right? I mean, civil registration, and in which case birth registration and regulations around marriage registration or marriage itself are critical, for instance, to prevent child marriage and subsequently also child trafficking or human trafficking in general. If they don't have a proof of their birth, of their date of birth, it's very easy to say that a girl is 18 years old when she's actually 13 years old, and therefore it makes enforcement of policies against child marriage very, very complicated. This is very important because this has a huge impact on these girls' life in the long term, including on their health, because they will tend to have children earlier. They are more at risk of gender-based violence. So that's one example among many other that I can think of.
One of my dear friends just had her 92-year-old mother registered because in her country of residence, they have introduced an old age pension. And her mother was not able to access that because she had no documentation. So they basically spent, I think, almost 6 months getting the paperwork and everything sorted so her mom could have her birth registered at the age of 92 so that she could receive this old age pension, which for their family was a very big deal. It's very practical, but we hear quite a few of these stories. And I think it is important to highlight that it's not just an issue for children, it's also an issue for older adults and even old people if they can't access the government services because of this lack of identification.
So how can we encourage the government and other stakeholders in the region to collect and use CRVS data more effectively?
Yes, well, I mean, this is mainly with raising awareness. So everywhere we go, everyone we meet, we are always promoting the importance of CRVS. And really, it's really about explaining with simple words the importance of CRVS and also convincing that the investment is worth it. So it means that, yes, it's a lot of effort. It means probably changing laws. It means training a lot of people. It means updating processes, outdated processes, updating system, digitizing system. But the investment is worth it because it will reduce cost. It will improve efficiency in the longer run.
One of the things that countries agreed to back in 2014 was that they would assess who were the ones who are unregistered in their countries. And when we reached the midterm review of the Asia Pacific CRVS decade in 2020, we realized that very few countries had done that. So some of the work that ESCAP has been supporting since then has been kind of technical support to countries to assess who are the ones who are not registered in their countries. Gaining a bit of a body of knowledge within that area. We can see countries inspiring each other. Also, we can start seeing very common patterns between different countries and who are the ones who are unregistered. Often, rural populations, younger mothers are less likely to have their children registered. Back in 2012, just before the Asia Pacific CRVS decade was initiated, there was 135 million children under 5 in Asia Pacific who were not registered. 135 million in 2012. In 2019, we had seen great improvements, and that number was down to 64 million children. But actually, the data from last year, which is fantastic, is down to 51 million children. So that means that we are now down to 1 in 5 children who are unregistered. Yeah, there's a lot of work to be done still.
Are there any other challenges that are related to achieving universal registration of vital events?
Well, I think, as you rightly said, universal registration of vital events, right? Because we tend sometimes to limit civil registration to birth registration, which is itself not yet universal and a challenge. But as Tanja just mentioned, another important vital event is death registration, which is lagging behind critically. And one of the reasons is because there is much less incentive to register a death. And then, of course, it requires large amount of funding to be able to implement those changes.
So, Tanja, do you see any positive and significant improvement in the recent years when it comes to CRVS?
Yeah, I think we've definitely seen some very significant improvements over the last 10 years. I think one thing that is really important is also to kind of institutionalize the change so that we don't become reliant on specific individuals or governments, because governments and individuals change. As an example, we've been really fortunate to support a few countries in producing their first ever vital statistics reports based on civil registration data, which is very exciting. But of course, those processes need to be institutionalized.
Well, I mean, I definitely agree that one of the main improvement has been fostered by good coordination, good leadership, whether it's from the government stakeholder themselves in a given country, but also in the region between the partner and the member state. This is very, very positive, and that has led to some improvement because there are some commitments, there are some plans, there are some timelines, and countries are working against or towards it. One of the improvement or process change that we are promoting through some standardized CRVS improvement methodology, it's what we call the health CR link. So really establishing linkages between the health sector and the civil registration sector.
Thank you both for fascinating insights. And before we wrap up, what would you like our listeners to take away from today's conversation?
I think that even though there has been very rapid and good improvement in terms of CRVS in the region, there is still a long way to go to achieve a universality of vital event registration. We encourage all partners, all donors, and all government, right, to really continue the effort towards CRVS improvement in looking at all the aspects of really strengthening those systems to finally achieve universal registration.
For me, I would say, I mean, if we are really serious about leaving no one behind, if we really want to achieve the 2030 Agenda for Sustainable Development, I think in really knowing who all of those people are and giving them the best tools to achieve the rights and the protection that they have the right to, I think civil registration and vital statistics is really a fundamental building block.
Thank you, Tanja, and thank you, Romain. That's all for today's episode of The Original Solution. A big thanks to our guests for sharing their expertise with us and letting us know that the statistics is a building block for everything for sustainable development.
Don't forget to follow us on social media and subscribe to our podcast for more inspiring stories from ESCAP.
Until next time, stay curious, stay engaged, and be part of the solution for our region. Have a great week ahead. Thank you.